Welcome everybody to our Global Blockchain Monday from the Hanseatic Blockchain Institute. My name is Anna Graf. I'm a member of the board and happy to present today with Anton a very, very interesting topic, healthcare and blockchain. Hi Moritz, now you are back with video. So Moritz, I don't even know if you're listening or not. Anyway, this is Moritz, who founded the blockchain, the Hanseatic Blockchain Institute a few years ago. And if you want to check it out, go to blockchaininstitute.eu. We are always happy about new members who want to participate. Also with our new study, W3 Now, for companies and institutions to figure out what the space looks like at the moment. I think I will share the links in the chat so that you will find this later. But now to you, Anton. You're joining from Trondheim.
Yes, that is correct. So thank you so much for inviting me to your session here, and I'm very pleased to be able to present to you a small piece of what you can do with blockchain in the healthcare space.
Cool. Tell us a little bit about yourself if you start presenting. How long have you been there? What are you doing right now? I read Accenture for preparation, but you also started your own company. So very interested to learn more about you.
Sure. Yeah. So I started within this blockchain space about 5 years ago when I started on a PhD. So I started as a researcher at the Norwegian University of Science and Technology, which is based here up in Trondheim, far up north. So started this research project 5 years ago, and quite recently finished the PhD and the research project. So started this with sort of a blank page looking into what could actually blockchain contribute with in the healthcare space or the whole healthcare sector. And for you who has been in the blockchain space for a number of years, you know, 5 years ago, it was at least in the sort of healthcare context, it was quite sort of clouded by a lot of sort of unrealistic proposals and a lot of hype, if you will. But I think for the last couple of years, the topic has really matured, especially in healthcare. We saw sort of a boost with COVID of use cases, and we saw some real implementations of the technology within the space, which is very exciting. And nowadays, I think it's more relevant than ever, even though it was probably more attention of blockchain in healthcare a few years ago, but I think it's very much relevant today. So besides sort of still going with this research project a little bit on the side, and also looking into the commercial possibilities of what I will present to you shortly. I work as a specialty consultant for, as you mentioned, Accenture, a large consultancy firm, working mainly in the healthcare space and somewhat in the blockchain space as well.
Super cool. Thank you for introducing yourself to us. I myself got in touch with healthcare and blockchain once through Bertelsmann, because I work for Avato Systems, and we also have a department for healthcare, which I found super interesting because we basically also developed the European verification system for medicine. So this is one of the use cases that I see, and also through a good friend, Joachim Schulze, who is now also developing in I think it's Sweden that they went first for really, I think it's for diagnosis of some illnesses. I think it's a disease for like neural whatever thing, and they use blockchain technology and AI. So I think especially in the public sector and all federalistic systems, it's very interesting to use blockchain for verification and also for decentralized storage. So and for the audience, if you have any questions, feel free to put them in the chat. Maybe at the end we can also open the stage, depending on how much time we have left, for more questions if you want to join us here. So Anton, feel free to start.
All right, thank you very much. So let me see if I can just start sharing my presentation. Okay, I hope you can see it
works.
now. Okay, perfect. Very much. Thank you. So what I will present to you here today is basically, or short, is a decentralized physician credential service. And this service or this concept we call Verified Med. And you see the presentation here is labeled with NTNU, which is the university I was a researcher on and still is. So this whole project is has its origin from the university and my research project within that university. So I already introduced myself a little bit. You see somewhat of my information to the left here. So engaged both in the research field of blockchain in healthcare and also some various interest group across Europe and across the world in the topic. And since the concept of Verify Med started as a research project, what you see to right here is sort of somewhat of the research credentials of or the research results of the project. So if you're interested in more sort of technical details of what we have been doing here, we have several papers that is openly available. So just take a look at those. We also have some. We have the first version of this concept that code repository is also openly available on GitHub for those who are interested. So this is some of the results with some papers, and we have currently in the second prototype of the solution of the service, which I will get back to. So just putting this a little bit into context first. So I assume that the audience here comes from various different industries, so you might not be that well aware of the healthcare industry. So just a very short sort of context here is that, well, as you probably know, as a user of a healthcare system and as a patient, as healthcare is really undergoing a real digital transformation, and you could argue that this transformation is a little bit further behind than in other industries, but I think partially due to COVID, I think this transformation has really picked up now, and we see a lot of movement in the digital transformation within the healthcare space as of now. And one part of this digital transformation is that we start to explore how you could deliver health services in other ways, so not in a physical space. So I think we're moving more and more away from you as a patient going to a physician's waiting room. You're sitting there waiting for a physician in a white coat. You see him or her, and then you head back home. So I think we're moving more into a virtual healthcare space, and a part of that could be that you meet your physician or any healthcare professional really in a virtual space. That could be, for example, in a video call like this, or perhaps in the quite near future, you might meet your healthcare professional in a metaverse context. So this is sort of the direction that the health service is going, and we saw naturally a rapidly increased of these virtual health services during COVID when we tried to minimize sort of physical encounters. Then more and more physicians and healthcare providers start to offer these services, and you saw that quite a lot of healthcare problems and healthcare issues could actually be dealt with in a virtual context. So you don't really need to have this physical encounter.
Anton, do you have numbers on how many people are using this in Norway? Because you don't have that many big cities, and sometimes you have to travel a lot, I guess, more than in Germany even. So are there any numbers available on that?
Yeah, so that's a good question. So the number I have is that if you compare to how it was before and after COVID, so before COVID, I think it was somewhat between 10 and 50% of family physicians, so general practitioners who used telemedicine and virtual healthcare as a tool in their practice. And then during COVID, that raised to over 85%. And I think after COVID has stayed at least above 50%. So has definitely become a integrated part of the practice in some healthcare specialties.
And are there also numbers, last question, on like whether they use more this Zoom kind of style calls, or are there already physicians practicing in the metaverse in a virtual environment, maybe with avatars?
So at least in Scandinavia, I haven't seen any sort of real implementation of a metaverse. So it's mainly different platforms of video calls that is used. I have seen some experiments with metaverse, but I don't think there's any, at least in the Nordic, that there's any implemented in use. But
so this is
sure,
still a topic to come then, or do you think it will stay with the video calls?
No, so I mean, healthcare is a very conservative industry, and I mean it's getting better, and I think healthcare professionals are getting more open to using new tools and especially new digital tools. So I definitely think it will happen that some of health services will move to the metaverse, but yeah, we need to. I think we need to have patience, and we need to sort of respect that is a conservative industry. For I think some of that conservatism is for a good reason, because healthcare professionals, they really want to sort of be sure that the tools they use are sort of verified, and this is working and this is safe and so on. But yeah, I think shortly we will see some health services moving to the metaverse. But with that, I think we're getting into the sort of the issue or the problem that we're trying to address with our solution, Verify Med. So,
but of course, I was expecting this. Magnus already gave us an example from Kronans Apotek, who are live in the metaverse. It's in Sweden, and I guess it might be Decentraland, or where are they live, or is it spatial? I think we are continuing now. We can come back to this topic later, but now, Anton, back to the blockchain.
Yeah, that's very cool. Thanks for sharing that, Magnus. And it's nice to see that another Norwegian or Scandinavian person is in this call. We have met in other.
I know. That's why I invited him.
All right,
let's go.
Okay, so there is a lot of evidence that. Well, I mean, trust between a healthcare professional and a patient is sort of crucial to be able to deliver good healthcare, good health services. And there's been a number of studies, and there's a lot of evidence that some of this trust is sort of tied to the physical space of healthcare. So traditionally, you will walk into a room where you meet a healthcare professional, perhaps a physician. He or she will sit there in a white coat, look very professional. He or she might have diplomas on the wall, and so the whole setting makes you as a patient to trust this person who sits in front of you. So you trust that this person is capable, has the right competence, and wants what is best for you. So that is sort of the core foundation of the trust in this interaction. So what happens when we move to the physical space and this trust, the trust mechanism that is tied to the physical space sort of disappearing? So we can take two perspectives here. So if we start with a patient perspective, so I think patients today is sort of very much a consumer-driven patient. So we put other kind of demands on healthcare professionals and the healthcare sector than perhaps the previous generation did. So the generation that maybe between 15 and 40 years old, something like that today, we have these demands of that we want health services delivered fast. We want the best possible health services, and we want to be able to find the right competence. That is sort of the thing that is the consumer-driven patient wants. So we don't really want to go and sit in a waiting room waiting for a healthcare professional to have time to see us. We want it on demand, and we want the best possible healthcare. And then briefly, just on the healthcare perspective, or the perspective of the healthcare professional. So in other professions, there's quite common that you have a portfolio of your work history. So, for example, a graphic designer or photographer, after they have a portfolio over previous work that they have done, and a carpenter or a plumber might have a portfolio of a happy previous client that he could refer to when he tries to get new clients. But in the healthcare industry, this doesn't really exist. So a healthcare professional doesn't really have a good means to be able to collect their experience and the work history in a sort of convenient way. So we saw when we started this project, we saw a need from the healthcare professionals that they wanted a means to be able to collect both sort of official documents, the official credential that you have your medical license, you have taken these courses, you have this specialty, but also sort of work history credential that you have seen this many patients with this healthcare issue, you have participated in this many surgeries of this kind, and so forth. So this was quite a clear need, especially amongst young healthcare professionals or young physicians.
And this also proves, like, if I get very bad recommendations on Google, that they might be wrong, considering my own history of success factors, so that this also helps me get over the usual social media platforms, right?
Yeah, that is a very good point. So there are these sort of physician rating platforms. We have one in Norway where you as a patient could rate general practitioners, and these sites are usually very they're not very liked by the healthcare professionals, because then you don't get the objective truth from the patient. You only get a handful of patients, usually unhappy patients, that sort of review you on this platform, and then the healthcare professional has no control over their own reputation on these sites. And that is actually one of the arguments also for this concept that we developed here. And the key part that is that we wanted to create a portfolio or a platform where the user or the data owner actually had control over their own work history over the data. And this is one part of where we introduced the blockchain. So moving forward to the actual concept of VerifyMed. So what this is basically a digital wallet, or we like to call it a digital portfolio of work history credentials for healthcare professionals. So as I mentioned, some part of this credentials could be sort of just the official credential of healthcare professionals, but another part could be that we have incorporated a feedback mechanism in the service, so that a patient makes what is called patient-reported outcome measures, which is a sort of a standardized way for a patient to report the outcomes of received treatments. So that is reported back to VerifyMed, and then the healthcare professional could take that, quantify that in their own portfolio. So they could say that they have met 100 patients with this kind of healthcare problem, and of these 100 patients, 90 of them responded well to the treatment, and 80% responded well to the overall health service that were given.
How is this data being processed? Is it just an enrichment for the healthcare professionals, or is it then also forwarded to other institutions?
Yeah, so that's a good question. So the data in itself is actually is stored in a cloud environment in VerifyMed, but the control over this data is totally in the hands of the healthcare professional. So the healthcare professional has all the keys of controlling that data. And I think the next slide gives a better view on that. So the healthcare professional could then choose who to share this data with. So he or she could choose, okay, that I'm going to apply for a new job at this hospital, then I would like to share these and these data items from my portfolio and be able to share that. Or he or she could choose that, okay, I'm going to meet a new patient, and this new patient might be interested in seeing my certificates and my medical license, for example. And I could choose that the patient could see that. So this is sort of a high-level architecture of how this works. So we have a number of credentials. As of now, we have these 6 credentials that you see on the screen, but this could also be extended or limited to fewer credentials, depending on user feedback that we're currently collecting. So the actual data here, as in many blockchain solutions, are stored in the cloud. And in this version, we use the IBM cloud, but then we use the blockchain. In this case, we use Hyperledger to sort of verify that the provenance of these credentials and be able to have all the key management and the access control handled on the blockchain. And this is just a screenshot of the prototype when we had it up and running. This is from a web browser. So in this prototype, we wanted to show that how this could sort of be displayed to the users. So we will have sort of one user interface for the patient or the general public, and we will have another user interface for the healthcare professional. So the healthcare professional will have their wallet and be able to control access to that wallet. And as a patient, you will be able to log in to VerifyMed and search for example. You want a physician that is an expert in headaches, for example. Then you want to find a physician with expertise in this that has enough experience. So then you could search in the database on headache, and then you will find physicians that has these credentials that meets your needs.
How many participants do you already have? Are you still in the testing? Is this still a prototype, or is this a final version?
So this is still a prototype. We run this prototype through feasibility studies where we had a number of users that were testing the prototype. So we're currently making some updates, and then hopefully we will move into a pilot phase. We would pilot this concept with a larger group of users, both patient and healthcare professionals. So
is this for Norway only, or the Scandinavian countries, or?
So currently it is only tested in Norway, but the vision of VerifyMed is that because that is also something that we see in healthcare, and that we will see, I think, more and more in the future, that health services is going to be delivered more and more across borders. We see that in the US, it's more and more delivered across states in the US, which is a little bit challenging regarding the credentials, because there you need to have your license in the state that you practices. So you wanted to have sort of a solution where you could verify that you have the right to practice and all your skills that could work in across borders as well. And also in Europe, we see that some health services are delivered across borders. For example, in Ukraine, some telemedicine provider has offered their services to Ukraine to be able to mitigate the stress on their health services in the current war that they are facing. And also in East Africa, there are some projects where European telemedicine providers are providing healthcare services to a number of African countries. So I think especially in these cases, it's very important that you as a patient, because then you might have even less trust in the physician or the healthcare professional that you're going to meet if that person is from another country. So then I think it's even more important that you have this kind of mechanism that could enhance trust in this virtual encounter, that you can able to verify the skills, competence, and experience of the healthcare professional that you're going to meet. But yeah, great question. So just briefly, the next step here is we're working with this proof of concept, with this prototype that we're currently updating and trying to refine, and then we hope to move into a pilot phase. Future version of this, we want to see also how we could verify the competence of AI worker or AI algorithms in sort of the same way that we use now for real healthcare professional or human healthcare professionals. And we also want to tailor this a little bit more into a metaverse concept as well. So that is the plans for the near future here.
I will connect you with Joachim Schulze after, because I think you don't know him, but I think that will be a good match. All
right, great, thanks. So I think, yeah, with that, thank you very much. There was a brief view into Verify Med and into one of many use cases where you could use blockchain within the healthcare space. And I think, I mean, there's a lot of other use cases that we can also talk about, but I think this is one use case that I think has real potential. We have seen similar concepts and companies formed in, especially in the US. I haven't, as of yet, seen any companies addressing the same in Europe as of yet, but I'm quite sure that other people will move into this use case as well.
Thank you very much. Now, are there any questions from the audience? Otherwise, I would like to ask a question. Okay, there it comes. Why Hyperledger? And why not a public network? I have an idea on that, but please explain that.
Yeah, it's a great question. And I think I think the preference would be to go with a public blockchain, and we tried to do that in the first version. Then we used Ethereum, and at that time, this was 3-4 years ago. The price of Ether was much less than it is today, but already then it was quite. We saw when we did some experiment, we saw it was quite unfeasible to have this service with that many transactions, because it suddenly got very expensive for each sort of patient that we had in the system. And now when the price has increased, it will be even more costly. But then of course there is other public blockchains that doesn't have the same cost, and this is something that we're currently exploring as well. I think that the Hyperledger Fabric is a blockchain that works quite well when we only, as of now, working within the context of Norway, because here the institutes that we want to have a part of the consortium are sort of inclined to trust each other. But I think if we want to scale this up and have it as a global service, then I think we should definitely try to again move it to a public blockchain.
Okay, so I hope this answered the question. So thank you very much for that. Looking into healthcare, this is where we started talking about different countries. When I was at that Congress, we talked about how to really bring it to public. We're talking about Africa being a country where people might not have an ID, but they do have phones. So we were discussing whether this concept of using the blockchain could be just like going into Web3 directly for healthcare. Also, India, I think, is one of the markets that we see as very, very interesting for healthcare. Have you already been looking into this more deeply, or are you focusing on Norway to have a good start, to make it easier, or are you already looking into moving there?
Also, the part with the identity management within the system that's a great point, and I think it is very important that both a healthcare professional could trust the identity of the patient, and also that other way around, that the patient could trust the identity of the healthcare professional. And here in Scandinavia and in a lot of European countries, we have quite a good system with, here we call it the bank ID. Now I don't recall the name of it's a European umbrella that uses the same technology. So we have the option to use that to be able to verify the identity here in Norway. And
is it like a KYC process, know your customer, where you identify online, or what?
Yeah, exactly. Yeah.
Okay. Yeah.
But then
we have different like ID Now, for example, is one of the companies that does that, but I think there are many players in Europe who can identify you through ID. Yeah.
Well, we looked into using a decentralized identity management for this concept as well, and I think that's the way or the direction that we want to go. So we want to have we want to make this service as decentralized as possible, and we don't want to be dependent of a national ID provider, or here we are dependent on banks to be able to provide us this ID, and that's sort of the quite opposite to the vision of this service. So we do looking into to be able to provide a decentralized identity management service, and as you mentioned, this is even more important in countries and areas where digital identity is not that widely used across the society as of yet.
Yeah, or digital identity instead of having like a ID card that you're not getting, because I think 1 billion people are lacking of this one. So the digital identity could come in there very handy. And we also have a question from Sai. Thank you very much. I don't know if that is. Thanks, Anton, for the presentation. It was very interesting. From my understanding, patient outcomes of treatments are also included in a certain way in an HCP portfolio. So my question is the ownership of this data. Any thoughts on it?
Yeah, so we capture a version of patient-reported outcome measures in the service here, and who is actually the owner of that data is quite a good and a bit tricky question, because that data is for our use case, we see that data to be useful for just the healthcare professional to be able to prove that they have seen this patient and the patient has had these outcomes. But this data is also, of course, very important for the healthcare provider as the institute to be able to learn what kind of treatments and health services that actually works, and also for researchers within the healthcare field. This is actually very valuable data. So as of now, we have made it easy to, when we say that this is owned by the healthcare professional that uses the Verify Med service. But I think we need to have a deeper discussion on how to best utilize this data, and who should actually own this data once it's sort of de-identified, and so on. I hope that answered the question.
Sai, okay. I see clapping hands. Maybe that's from Sai. I can identify it. So I think this is a yes, I would say. Anyone else with a question? Otherwise, I think that I have some more maybe. So, but I also want to leave the space for others. Also, if you want to join us on stage, maybe you can end the presentation. How can people connect with you best before we forget this, because you don't have that LinkedIn code here? Is there like how if anybody has a question after, because this is being recorded, and so it will be available also after this live session?
Yeah, thanks for bringing that up, Anna. I think that the best way to connect with me is either on LinkedIn, and I could post the address to my LinkedIn page in the chat here, or on my email, which I could also post here in the chat. So very open and happy for any connection from people that are interested in this use case or other use cases within the healthcare space.
And for everybody who is seeing this as a recording, because they will not see the chat, I think if you enter Anton Hasselgren, the name that you see here in the recording, you will find him on LinkedIn. I think there are not so many. So, and just in case you enter Norway, and then you will find them for sure, or Accenture, something like this. And then you can connect there. Anton, looking like into the future, how fast do you think we will progress? Because we were also talking about AI as a chatbot, I guess. I have also learned that AI for diagnosing diseases works a lot better most of the time than like the real doctor. How do you foresee the future like in 2 years?
Yeah, this is quite a sensitive topic, I think, amongst healthcare professionals. So I'm not sure if we have anybody here working in the healthcare industry, but so
even if I mean I think if we discuss these things openly, the same thing happening for designers. Like literally 95% people say it could be replaced by AI. So I think it's a general topic, and it's better to face things instead of just being quiet about it and then it's suddenly there.
Yeah, definitely, I agree. And I mean the progress that we have seen in the last year around AI in general, but also AI in healthcare has been enormous. And now there has been several of AI algorithms that has outperformed medical students in the medical exams that they do in the US. So that is quite remarkable. But what also shown in quite a recent study that I read, that they compared the answer that the patient got from when they met a real physician in a online or virtual forum. Basically a chat with a physician, and then a chat with the AI. This case, I think it was Chat GPT, and they compare the answers in what answer the patient sort of liked the most. That meaning that sort of goes against the argument that a human will always be more. Have more empathy and be able to understand the needs of the patient and the human in a better way. But this study actually shows the opposite, that the AI algorithm or the AI bot showed more empathy than the real healthcare professionals. So.
But they didn't have a face-to-face conversation. No. Maybe that would have helped, like mimic-wise, because
maybe, but then again, then you could have a AI generated face as well that just spoke the words and with the right facial expression, and maybe that would even be more favorable for the AI than compared to a physician. Well, I should also mention that this study has some flaws and maybe some things that you could argue against this study as well. But I think it was very interesting as a concept to see that, okay, this argument that has been quite a strong argument previously, especially around the empathy, that could actually be questioned.
Okay, my computer is back. I was just worried because it went black, but I could still listen to you, so it's fine. If I suddenly disappear, then my laptop just gave up and died. So far, it's now I'm back to seeing you. This is good. Yeah, but well, I also think like for the future in general, even if I think this part of empathy in a chat is, as I said, a little different. This is why we might need the metaverse as well, as you suggested. In a way that we have this interaction and also the mimics and maybe avatars also for children. I think especially if you have a diagnosis that is very bad, you might need something more than just a chatbot. Not sure about this one, but it might be helpful for some people to also have like some direct connection to somebody who has this kind of empathy. But what we will see, I don't know, maybe the chatbot is even more empathetic than humans. Would also be a learning in the end that we have to improve in this way. So that's quite interesting to hear. How many people participated in that study?
Oh, I don't recall. I think it was 350 or something. So it was quite a big, large sample.
Okay. Let's see. Not sure. With the new ChatGPTs, whatever, this number might then even outgrow because they can fake so well that they are humans. So, but in 2 years, you think we will have some metaverse with an AI that helps the normal physicians to keep the patients alive? Do you think that people will live longer or shorter? Because I think in Germany, the numbers have been decreasing, which was kind of so not speaking for our healthcare system, and really tells us that something has to be done here.
Yeah, you see the same in the US, that the average life expectancy is actually declining. But that is due to, I mean, in the US at least, that is due to gun violence largely, because then some young people
drugs. I think it's mostly drugs. I just
drugs
saw
as well, yeah,
like it's like really this medication, the painkillers that are so many people addicted to, and this has become the #1 killer for people under the age of 35, which is quite disturbing that there are still doctors who are giving prescriptions to these kind of medications, which could, of course, be maybe prevented with your system, to be honest. If you see that a doctor is doing this on purpose all the time, you might not want to go there. And then you have the statistic on this as well.
Yeah, that is true, as you say, that the opioid epidemic in the US has really is a big, large problem for sure. But just to get back on sort of the future here of healthcare and what probably will happen in the next year. So, I mean, the population is getting older and older. So we see this demographic shift in the population. So we will have a larger proportion of the population getting older. And if we're going to continue delivering health services as we do today in the same manner, then just here in the Nordics, just in 25 years, then 50% of the population needs to work within the field of healthcare to be able to accommodate for the large group of elderly people. And this is, of course, infeasible. So we need to look at other ways to deliver healthcare that we don't use today. And I think this is, as I mentioned, healthcare is a very conservative industry, but I think everybody's starting to realize this and that this demographic shift is actually happening as we speak. So we do need to make changes on how we deliver health services. And I think one of these changes will be that we more and more services will be delivered in a digital medium, either by a real physician or by an AI physician, perhaps in a metaverse. But that is so much less resource dependent. So you can have so much more output from the healthcare services when you try to manage or try to use these kind of tools.
Do you also think that this will help democratize the healthcare market in general? Because at the moment we see there are the patients who can just pay for really high-class service, and then there's the others who have to wait for months at the moment to get any kind of service. And I think the number of people who are in the second class is increasing day by day.
Yeah, that is true. But I mean, the scalability of a say an AI doctor compared to the scalability of a human doctor is, of course, much better. So hopefully, because that is also part of the problem that we have as of today, we have a large lack of healthcare professionals all around the world. In almost all countries, we have a lack of healthcare professionals, and in some countries this lack is much larger than in others. But there are already now a huge need for more healthcare professionals. So if we could use tool where one healthcare professional could be able to deliver health services to more patient, or if we could have some kind of automation, some AI workers that take some of the work burden away from the human healthcare professional, I think that's one way of scaling the healthcare system.
And also for the development of drugs and medication, I think if we have enough data, it could close the gap of gender inequality at the moment, helping find the right medication also based on your genetics, your gender and everything. And if this all is interconnected, of course, there's always people will be afraid of the misuse of the data. And on the other hand, it can open a lot of doors. And this is why I personally feel that having this stored in a decentralized system is very, very valuable, and not having it with only one company that might be hacked or might misuse your data. And I see many advantages coming here also from this side if you use cryptography in the right way. And now, since this year is the year of the AI, I make a prediction right now. The next year will be the year of the quantum computer, adding a lot more speed to all of this, and will lead to more interesting developments, I hope. And we will see what this brings. And Niels, thank you very much for joining and saying goodbye. we had a huge Hamburg crew here today, and thank you very, very much for being with us. If there are no more questions, Anton, I thank you from the bottom of my heart, and I don't know if you will be in Germany soon. We have a healthcare symposium from Avato Systems in May. Maybe that would be also interesting for you to visit. It's in Berlin at our very nice representative building at Unter den Linden 1. And for everybody in the healthcare sector, I think it's open and you can still register there. So I'd love to see more collaborations. Also, people maybe trying it out in the German market, because I always see people going to the Scandinavian countries. Scandinavia is so much better for that. But of course, we need testings also in the other countries. And I see that Estonia is moving forward so fast, having digitalized everything. So I would love to see some projects here as well, and encourage everybody. I don't know who we should talk to the governments or whatever, but it will be cool to see this here as well. And I'm hoping for that soon, maybe in 2 years, because we are even more conservative. I don't know, but trying our best to push this forward as well, because as I said, I see a lot of opportunities. Of course, there are risks, but there's always risks. And if we do not innovate, if we are not curious, nothing will happen at all. And you have talked about all the good things that can be done with it. And so all the best to you and your team, Anton. And maybe also for blockchains or so in Hamburg. I don't know. It would be good to have somebody from the healthcare sector who's really doing things there, because I always love to see the products. I mean, it's great to talk about blockchain in general, but if you then really show the product and what the solution is that this product brings to public, I think for us, it's a lot easier to explain why we should use blockchain. And this is what Blockchain Mondays are for. Thank you, everybody who joined, and greetings to Trondheim. And I hope the sun is shining there as well until midnight or even longer. I don't know.
Almost. Yeah, thank you very much, Anna, and thank for everybody who listened to this. I really enjoyed this conversation with you, and yeah, please forward me the details to that meetup in Berlin. That sounds super interesting as well.
Will do, and also connect you with Joachim Schulze. Shout out to him if he ever sees that. He was the one who brought me into this whole idea of how important blockchain is for healthcare, and so I'm very grateful for this. Have a nice evening, everybody. Enjoy the sun outside, and see you next time. Bye-bye.
Bye-bye.